Everyone. My name is Charlene Bergstresser and I'm from the LVAC office. Couple housekeeping items this evening before we begin our program. The session is being recorded and this is a Zoom webinar, so you will be in webinar mode. You will not have camera or ability to audio to the panelists, but we do ask that when we get to our panel portion, if you have any questions for our panelists, that you put them in the Q&A area, which is located at the bottom of your screen when you're looking at the line along the bottom. Also, if you are having any technical difficulties at any time, you can send a private chat message to the media services person in your chat area, and we'll try to assist you with any technical problems you might be having. In the chat, you will see that we've put a link for the live transcription service if this is something you wish to use. And in a moment, we'll also be putting a link to the agenda and program for the evening if you did not receive that in email. So without further ado, I'd now like to introduce Dr. Mary Liz Doyle-Taduni, who is the division head of the Division of Nursing at DeSales University, who's going to kick off our program for us. Mary Liz.
Okay. Thank you, Charlene. Welcome everyone to the third Nursing Research Collaborative of the Lehigh Valley, Nrclv, sponsored by LVAC. The Nursing Research Collaborative of the Lehigh Valley is an alliance of the nursing schools, Cedar Crest, DeSales University, and Moravian College. The Nursing Research Collaborative has been committed to creating and sustaining a local nursing culture that encourages the exploration and application of evidence-based nursing practice and research inquiry through mutually shared efforts and goals. Ultimately, this collaborative was established by all three of these university nursing schools to enhance an alliance to share efforts in educating our nursing students in research. All of us have experienced the coronavirus pandemic this past year. The pandemic has brought many challenges to all of us and our nursing profession. We hope that through this panel discussion this evening, that this will be an intellectual, practical, and learn experience where we can reflect upon our personal experiences in living, studying, and working through the COVID-19 pandemic, and share some advice on how all of us have coped. This evening, we'll conclude with information and resources for building resilience, incorporating self-care ideas into our everyday lives. So thank you all for participating this evening. And at this time, I'd like to introduce Dr. Wendy Robb, who is the Dean of Cedar Crest College. Dr. Robb.
Good evening. So thank you, Dr. Doyle-Taduni, for those important remarks. And it is certainly an honor to welcome and introduce our celebrated alumni to this very important discussion. These alumni are nurses licensed and working in the profession of nursing for only a very short time in a world that's been redefined by the pandemic. When I graduated from nursing school in the 80s, HIV and AIDS were the most important and most difficult challenges of the era. There was fear, there was misunderstanding, and the initiation of new technologies for care. However, none of us have been through or experienced what these new nurses have and what has become their new normal. Their perspectives, their experiences, they're very unique and they're valuable. And we welcome them to our event to share their honest and sometimes difficult stories. So it's my honor to introduce Yasmin Glennon from the class of 2020 from DeSales University, Sarah Harshaw, class of 2019 from Moravian College, and Erin Rooney, class of 2020 from Cedar Crest College. This discussion will be moderated by faculty members Dr. Tricia Berniker from DeSales University and Dr. Karen Groller from Moravian College.
Hello, and I want to welcome our panelists to put on their cameras and to join us. Just want to thank each of you again for coming tonight and spending your times opening up your hearts and having this conversation with us tonight as we embark in this timely and critical conversation. And I think we need to get Yasmin up here yet. There you guys are. So we know this has been a very trying year for you all, as it has been for every nurse through this time. So we're going to have some couple questions and conversation. We want you guys to just relax. Feel free to answer any or all of these questions. Okay, don't feel like you have to repeat. You can easily say, oh, I agree, or I don't agree with any of it. All right, so the first question we actually have for you is we were wondering, as you guys entered your practice during this unprecedented time in modern healthcare, we were hoping that you could briefly tell us what was a typical day and how it has been for you as a typical day. And if you could tell us how you have either felt prepared or not prepared for nursing during COVID.
I'll start. I'm Erin. So a typical day for us, I work in the ICU personally. So a typical day I will have ideally 1 or 2 patients. If I have 2, they might be on Optiflow, like a high flow nasal cannula, or sometimes we might have intubated patients with COVID. Proning is a big thing that we do a lot, where we turn patients on their bellies. And ideally we would only have 1 patient in that scenario. However, with staffing shortages and a lack of resources, we might still have 2 or even 3. So if we have a patient on Optiflow, our primary concern is really making sure they're able to maintain their oxygen saturations on their own. If they start to decompensate, we might ask them to turn on their belly, which is something that not a lot of people are comfortable with. So that becomes kind of like a struggle, trying to help them. And really, we just hope that we don't end up having to intubate during the course of our shift. If we have prone patients, typically they're on sedation, paralytics, medicines to maintain their blood pressure. So it's a lot of titrating all of that, making sure they have all the medicines they need. The more stable patients will turn their head side to side to make sure they don't see skin break down on the sides of their face from the breathing tube. But sometimes when they're really unstable, we can't even do that, because turning something as simple as turning their head side to side can cause their blood pressure to drop, their oxygen to drop, and it's just not safe for the patient. We might have to prone the patients. So someone that may have been laying on their back, we have to flip them over, which takes a team of nurses. There's usually at least 3, sometimes 4 or 5, and 2 respiratory therapists to maintain the patient's airway throughout the entire procedure. I remember sitting one of my last post conferences in nursing school, talking about our fears coming into COVID, and a lot of us said not being prepared skills wise, not being able to help these patients. And really, I found that that wasn't the case at all. At the very least, you kind of know when something's wrong, when to sound the alarm. But what I wasn't prepared for was the feeling of helplessness when you see a patient on Optiflow who can't breathe anymore, and there's nothing else you can do for them, and you're just standing outside the door feeling completely helpless, or holding up an iPhone for families to FaceTime with their loved ones to say goodbye. And they're telling their sedated, paralyzed mom or dad, that they can't wait for them to come home. And deep down that they're never going to come home. So you can never be prepared for that.
Okay, thanks so much, Erin. You mentioned, and I don't want to cut off, but you mentioned the proning aspect. And I think that was a big conversation piece that I know initially started in the very beginning aspect of COVID. Mm-hmm. And I was just wondering, did you feel that was a big conversation piece that happened from a skill perspective?
Honestly, I don't know that I kind of saw that entire, the way it all started. I graduated in April. So the first round of COVID had kind of come through by the time I was on the floors working. I was there for the second really big wave. And by that point, everyone that I learned from, they were like professionals. So it,
Okay.
I guess it was more of like systematic than trial and error at that point. Like the people that I learned from were very like, okay, here's what we do. And that
Okay.
was that. And we just learned that way. But from what I've heard in the beginning, it was much different than it was for me.
Yeah. The only reason I had asked that is because I remember there was a lot of discussion board questions
Mm-hmm.
on med-surg certification discussion boards and so forth. So I was wondering. All right. Good. Go ahead. I don't know if anybody else has a conversation or a question to answer. Go ahead, Yasmin.
Oh, hi. So I, as a new nurse, I was fortunate enough to get a position in the cardiac ICU where I did my 17-week orientation, which I was very grateful for because I feel like it really helped my assessment skills and critical thinking skills. But like many new nurses, new nurse graduates, I was displaced. And since I got off orientation in November, I've been working in the cardiac float pool, which now means I can float to any ICU or low level or COVID low level in the hospital, which is pretty intimidating and sometimes overwhelming as a new nurse. So like my day, it just kind of depends on where I'm at. And, you know, in ICU, it's ideally 2 patients, sometimes 3, which is an ideal. Low level, you have between 5 to 6 patients. Again, you can definitely expect 5 patients. Some 6 is a lot. And then COVID low level for my hospital specifically, we've been utilizing something called team nursing. And that's where 2 nurses are taking care of 8 patients. And I will say I have predominantly been on COVID low level since I've been working. And the team nursing aspect is really great. And because that COVID low level specifically, it's basically all new nurses. So we're all trying to figure it out together. And I will agree with Erin in the sense, the things that have been most difficult, and nursing school prepares you, like assessments, recognizing when something's wrong, abnormal and normal lab values, depending on the disorder or, you know, what the patient's in for. But really, the lack of PPE was a struggle at first. You know, patients are requiring a lot more oxygen. You know, the goal is not to intubate them, but we've been using optiflows and then applying a non-rebreather on top of that because sometimes they just can't even maintain a O2 goal sat of 88%. And, you know, in nursing school, you learn that 92 to 93% is the ideal O2 goal stat, but it's been lower. You know, the goal is lower since COVID has rose. And then the no visitors aspect, you know, it's hard to tell, especially when someone's struggling to breathe and they just want a familiar face and their family to know that they feel safe. And you're just communicating this over the phone, and it's been really tough in that aspect.
Okay. Okay, Sarah, do you have anything to say before I ask another question with that?
Yeah, so I love how you asked what's a typical day in nursing, because I feel like there's no such thing as a typical day. I work in a pediatric ICU, so my experience was, I'd say, a lot more different than other nurses. We had the opposite problem where parents weren't super comfortable bringing their kids as much into the hospital, whereas before a parent would be like, oh, he has a runny nose, let's take him to the ER. Now they would only bring kids to the ER if they were like really, really, really sick. And being in the pediatric ICU, we weren't getting a lot of patients, especially because kids aren't in like daycares and things where they're just like swapping boogers all the time and sharing each other's germs. So we had the unique opportunity of being floated to other adult units, not necessarily to take patient assignments because it wasn't really safe and you don't have like all the like ACLS training that other nurses do, but we would be like PRN nurses or just like be a helping hand. And I really appreciate the opportunity because I got to see other units, and I'm just like to be able to help out, especially units that are so short staffed. But like Erin was saying, sometimes you just feel helpless because we didn't have the training to take care of patients like that. And our setups for children are a lot different than adults. Even like A-lines and certain monitoring equipment is completely different from a pediatric patient to adult patients. So it was a big learning curve to be able to help nurses. And, but yeah, it was just nothing typical. We would get floated to different units all the time because our unit was not occupied. So that was definitely an interesting experience, and seeing the no visitor aspect as well. Sometimes it was nice to be an extra nurse, just to be in a patient's room and sit and talk to them. And you always think like nursing and medicine and treatments and things, but sometimes to get someone feeling better is just someone to sit and just talk to them and ease their comfort. So that was really special, and I was glad that we had the opportunity to do that while other nurses that knew what they were doing on those units were helping take care of people. We had the opportunity to just sit and talk to patients or help with small tasks like IVs and things that we're capable of, but in a way that would help clear up other people's opportunities to spend more time with their patients. And it was definitely a hectic time trying to figure out everything, and it's still a hectic time trying to figure out how to best take care of everybody, so that instead of having this unit be a sinking ship and this unit be rising, we're all kind of like balancing ourselves out so that we can make things even and help everybody out at the same time. But it's definitely been, and still kind of is, like a crazy experience. And luckily kids haven't been too sick with COVID. We haven't had a lot of positive COVID kids, which is really great, but it's still scary to see like the outcomes that adults have had.
Yeah. You know that we would always trick you guys with asking for a typical day, right? Because I'm sure that it's always different every single day. I think that was interesting that all three of you guys had the same kind of theme, mentioning that it really wasn't a focus on the skill, at the physical skills. It was a focus on the psychosocial aspect of skills, the hopelessness, the communication, the therapeutic communication, the art of nursing. So I guess I have a loaded question in asking, did you feel like you were prepared as a new graduate transitioning into practice in having that readiness to be able to handle that psychosocial need that the patient had? I know Erin said that maybe not, you know, when you kind of said you couldn't address it, but.
I personally feel as though nursing school does really well preparing you for the knowledge basis you have as a nurse, but the actual art of nursing, you kind of figure it out yourself. And not to like scare any future nursing students, because I know that was my biggest fear starting, because I luckily started about a year before the pandemic rose. So I had a little bit of time to work on that sort of stuff. But it's definitely something you can't learn in school, and it just comes to you naturally as a nurse as you have that caregiver instinct. So it's definitely scary because it's a big step in your nursing career. And once you realize like, I am a good nurse, I can help take care of someone, I can make them feel better, it's not just XYZ, like I have that in me. I think that is a big mind block, that once you understand that, and once you understand your power as a nurse, it's mind blowing, and it's really cool to see.
Yeah, just to elaborate on that, I would say nursing school tries really hard to teach you about therapeutic communication and that aspect of it. But yeah, you don't get good at it until you have to do it. And especially in a life or death situation like we're in now, every single day, it's not the same.
Do you feel that it was just harder transitioning into practice doing this in the middle of a pandemic?
I would say yes and no. You really you get thrown in, like you get forced to be comfortable real quick. So I think in some ways it does make us stronger, but it's certainly not ideal.
Gotcha. Gotcha. All right. How about we ask you guys something else? All right. We know that eventually things are going to stabilize and that COVID will not be the primary focus of care, and that you guys will be able to go back to what we hope to be the new normal, right? And when you can think about nursing in the post-pandemic environment, what do you think you will need?
So I'm sure that like my hospital as well as other hospitals is, have experienced it, but because I'm floating around the hospital, not just specifically COVID units, I've seen fluctuations where there's predominantly just COVID patients, and then you have less COVID patients and an increase in common chronic disorders that you would expect to be admitted. But right now it's a bit crazy because I just worked the past few nights. But I think post-pandemic, and I've been starting to do it, honestly, when I first started, it was really difficult because you just feel so overwhelmed because everyone's feeling overwhelmed with COVID. But now that you've almost become acclimated to it, I've learned that I need to just kind of brush up on more detail-oriented care. And it's not to say that I'm not providing, or the hospital hasn't been providing detail-oriented care. I think there was just such an urgency and emergency type of care, like you're getting really, really sick patients and you just need to promote oxygenation, keep them alive and keep them breathing. And now that we're learning more about, COVID and what's working and what's not working, I think that care has been more effective. And I mean, hopefully, it's going to slow down eventually and we'll see more of those common disorders that you would see. And so my goal is just to get back to just learning as much as I can, and then, learn more about anything besides COVID.
Very good.
I agree with that 100%. We saw a little bit of a lull in our COVID cases there for a little bit. And I, for the first time in months, had patients that didn't have COVID. And I felt like a brand new nurse all over again. Like, I feel like I got really comfortable with COVID. And then I had, for example, I had a patient with a GI bleed. And the GI team came up and we were scoping her at the bedside. And I remember looking at the fellow and I was like, what do you need me to do? Like, I don't even know what to do. And he was like, what do you mean? Like, how long have you been here? And I was like, well, a year, but if flipping them over doesn't fix them, I don't know what to tell you. Like, that's the only thing I know how to do anymore. So there's definitely like a learning curve at this point that I feel like in a perfect world, new grads get kind of right off the start. And now like we're doing it all over again. And then the other big issue I think too, is the fact that we got so desensitized to abnormal vital signs. For our like really sick COVID patients, I'm not sure who said it, but someone said like, ideally you want to see an O2 sat like at least 93, and it's nothing for us to see 82, 83, or even in the 70s. And after a certain point, like there's nothing else you can do. So you kind of get used to just looking at it. And I had a surgery patient not long ago who was still on a ventilator and who was desatting into like the 70s. And it took me a minute to be like, wait a minute, this isn't normal. This patient doesn't have COVID and there shouldn't be this kind of oxygenation issue. And what do I do? So again, like the learning curve is just, I think it's going to be a struggle for a little bit.
I think as nurses and as like a community of humans, we need definitely a refocus on primary care. I feel like the whole time, and especially for nurses as well, like just taking care of ourselves. I feel like this whole focus on COVID has been treat the problem, people get COVID, they come in. Whereas now I think the communities like shine a light on, we should focus at this from the source, like proper hygiene, like basic things that you would think of, because so many primary care options were shut down during COVID. And I feel like we were getting, like I was saying before, we weren't getting a lot of COVID cases, but we were getting kids with chronic conditions that have been untreated for months. And it got them to a point where their baselines completely changed. So I feel like a big focus on primary care is in the future of and education about teaching people that there's ways to prevent being in the hospital in the first place. And I think another big thing that's come up during this whole pandemic is the need for mental health care, also for staff and nurses and for just everybody. I think that's been a not a secret pandemic, but kind of a secondary pandemic from COVID due to isolation and things. So I'm excited to see how it's going to evolve over time. And I feel like it was a big push for my hospital. People kept talking to you, and we would have consultants come around and make sure that the nurses were doing okay. Because sometimes when we're putting life vests on everybody else, we're forgetting to put a life vest on ourselves. And to be a good nurse, you have to make sure that you can recenter yourself and you don't completely get bogged down by like what you see and what you do at work. So I think that's a really important thing that all nurses need to focus on and have an outlet for like good mental health and making sure that they continue to take care of themselves as they take care of other people.
Yeah, you bring up a good point, Sarah. When you guys were first answering the first question, and you were talking about, meeting the psychosocial needs of the patients and having that struggle, and how you were grappling with that. I was kind of wondering, how do you cope with, trying to help the patient answer that last conversation with that family member, knowing that that patient's not going to be going home? And so how do you put that life vest on for yourself? So how did you guys cope with that during your first year?
I guess I'll be the first one to say we don't as well as we should at all. But the best thing I can really say, especially to nursing students, nurses and nursing students who are going to be coming into this world shortly, just don't forget to take care of yourself. Like go to the gym, eat, do whatever it is that you have to do to make yourself happy. Spend time, with your family the best you can. Just like don't forget about yourself, because it will like run you into the ground. And being so short staffed is enough to like drive you crazy. And then you put in just the high stress levels that we're all working in right now, and it's just a recipe for disaster. So I will say I'm guilty of it, but my advice to other people is to make sure you take care of yourself, whatever that means for you.
Yeah, I completely agree with Erin. And I'm still learning how, adapting to different ways to take care of myself, because I find, again, each week is different and every shift is different. And sometimes it hits a bit harder. But I mean, my mom and my sister also worked through the pandemic with me. So it's really just like confiding in them, and we're sharing stories about, just how shocking it is sometimes. So yeah, just like some support from your loved ones. And it's hard because you don't want to like stress your family out with the shifts that you had or the things you've experienced, but it's so important like to talk about it. Like a few months afterwards, I'm like, I had like, some of the stories that you think about and you don't, you haven't really thought about it. You really haven't felt that emotion, and then it just all comes out. But yeah, like she said, like get enough sleep. On nights, you try to have a social life still, but you got to sleep, work out, eat right, and then just do things that you're going to enjoy. I mean, it's been hard because of, COVID and lockdown and stuff, but it's been kind of nice just to decompress at home.
Good. So I can see that you guys are hoping to end up getting more diversity with your patient populations, right? As you're moving past post-COVID and possibly needing to get some reorientation. Do you think that there might be other things that are going to be different as you guys are moving past, or other needs that you might end up needing?
I feel like another thing that could be different is vaccination clinics. I think right now we're in an interesting opportunity because of the rush of getting COVID vaccines to people, which I think is extremely helpful in just like getting over this pandemic phase. it's going to be interesting to see if that's going to be something that carries on in the future for people, and there's a higher push on vaccinations, especially in the opportunity of working with kids when you get most of your vaccines as a child. I've seen conversations with parents come across a little bit easier now that they realize what a world is like without important vaccines. So I think that's going to be an interesting thing that comes up next in the world of nursing as well.
Very good. Do you have something else, Erin? Looked like you were going to say something.
I was just going to say, now that it's been about a year and we're seeing patients who have recovered and gone home, we're seeing more of like the long-term effects of COVID, of people who are really sick with COVID. So there's going to be a big learning curve with that. In the last, I don't know, week or two, maybe, I've had 2 patients that are now back in the hospital just with complications. So that's going to present a whole new array of issues, I think, because these people are people that thought they beat it, and now they can't get out of rehab, they can't go home, they're on steroids, they can't get off of them, and where do we really go from here? So I think both physically and psychosocially, as you were saying, it's going to be a whole new set of issues in the next couple months.
Very good. Yeah, I agree with that. And I also think that the vaccination clinics, it will be interesting to see if those stay true. And that expands into the new world of how vaccinations will be given in general, all vaccinations, right? I think that would be interesting as well. So we are obviously, the Nursing Research Collaborative is a research collaborative. So we're very into nursing inquiry, and you guys are frontline workers. So we are very interested to know if you guys believe that there are any research opportunities arising from this pandemic.
I think being at bedside, it's a bit tough to, because you're at the bedside, you're not really thinking about, or I mean, the news is sharing all new research that's coming out about COVID and stuff. But I think that research topics that are going to be studied more thoroughly is definitely like infection control. Already about the vaccines, you're hearing more about it, more about PPE and how effective, or what PPE is necessarily needed to promote effectiveness of control, the efficacy of proning patients, antibody tests, and then even different antibiotics that we're seeing being used for different patients. I think that's just a few just throw out there.
Those were all really good points. And from a more I guess nursing aspect of it, in nursing school, I know I did research on the nursing shortage. So that will continue to be a very hot topic. I think there are so many people leaving nursing right now. So that's something that's going to have to be looked into, as far as how to retain nurses, avoiding burnout. And I think it'll also be interesting to see nursing school admission rates, how, are there more or less people coming into nursing now with all this going on? Are people afraid? Are there more people inclined to come into nursing, and how all of this will affect that?
Mm-hmm. Looking at recruitment and retention is definitely going to be something to look into, for sure. Do you have any ideas, Sarah, too? Not to put you on the spot, but.
No, it's okay. I think a big thing too, which I'm interested for research is, and not to brag because nurses are pretty awesome, but we were already one of the top trusted professions. And I hated the term healthcare hero because it's just like kind of was a blanket statement on what was going on, and I absolutely hated it. But I wonder if there's going to be, I think it'd be interesting to see research on the community's perspective of nurses and healthcare workers, and if this pandemic elevated it or if it caused some concern. It seems like as though, and I appreciate that people were finally understanding that nurses aren't just people who give you medications and wipe your butt. Like we do a lot. And I think it'd be interesting to see research or have a research opportunity on the community's perspectives of a nurse's involvement in care, which I think would be pretty exciting to see as people now are finally understanding like everything that we do as a scope of a nurse.
That would be good as long as we can get a tool to measure that, right? For sure. Very good. Yeah, we are hoping that, you know, we can end up figuring out from frontline workers really what are the research opportunities that we can see from a patient perspective, right? And then also what are the opportunities we can look at from a nursing perspective? Because I'm sure that there are a lot of nursing needs that we can still utilize research for at this point. So I think that those are the alumni panel questions that we have. And I'm going to look at Dr. Bernecker and see if there are any kind of Q&A questions from the audience.
We do. We have a
All
bunch
right.
of wonderful questions. Erin,
Wonderful.
Sarah, and Yasmin, thank you for such a wonderful, wonderful discussion so far. And we have some great questions. So the first question that came in is, what do you wish you had been taught in your nursing program that would have made the most difference for you in the first year?
I think I wish that someone in nursing school or throughout nursing school like thoroughly explained to me, like, you are not going to know everything. You could get hundreds on every test. You could get like do amazing with practical exams. You could be the best nursing student ever, but until you're on the floor, that's when you learn all your skills. So it was a big mental thing for me, thinking I wasn't adequate enough. I was having a big imposter syndrome moment, thinking I had no idea what I was doing and I am a horrible nurse and how did I even do this? Because I thought going into it, I was like blindly thinking that I was a great nursing student. So I'm going to be the best nurse ever and I'm going to know everything. And that is the worst thing you could think of. And I think, and they're laughing because they know it's probably the same thing. But once you're on the floor and you're finally like doing tactical skills and doing stuff, that's when you get your nursing skills. So to all nursing students, you'll learn when you're on the floor and you're in your specialty, and that's when you become a true nurse. Right now, you're learning the backup skills, the knowledge basis, but don't be afraid to feel clueless when you're on the floor, because you will learn and you'll be totally fine.
Okay, should we go on to the next question? This is a great one because we have attending today, we have many students who are going to be graduating in May. So the advice that you're giving is wonderful. We have many that are graduating in August, but we have also students that will have clinical next year and for the remaining this year. And this question was, any advice for nursing students in clinical during this time and how they can best assist you most efficiently having clinical in the COVID environment? What a great question.
I don't know how things are everywhere. Like, I'm not sure if nursing students are allowed to take care of COVID patients, but if you can, I would say the best thing you could do is talk to the patient. Like we were all saying, like, they probably aren't allowed to have visitors in most hospitals. They're alone. They've been stuck inside the same four walls for who knows how long. Like, they're all incredibly anxious. I can't speak for everyone, but from my experience, the COVID patients are all very, very anxious, understandably so. It's about like talk to them, learn how to talk to them, like pay attention to how, like the other nurses on the unit interact with them, because like we were all saying, the one thing that we weren't really prepared for was how to support them psychosocially. Like we didn't know what to do. So try to just like learn as much from that experience as you can, because you will need it when you're on your own.
Okay, let's go on to the next question. This is a very interesting question too. How have you handled or coped with COVID patients who are resistant that COVID is an actual thing, that this is actually happening in our community. Any advice would be greatly appreciated.
I don't know if I heard the question correctly. I think I did, but you can correct me if I'm not giving a proper answer. I will say that anybody who's really coming into the hospital has been fearful. I have, patients who aren't coming in with COVID, they're still wearing their mask in their bed, in their room. And we say, you can take it off, all the staff is gonna wear, and they are really terrified. I think it's more, like friends and family and people you're seeing on social media who are saying, oh, they're expressing their doubts about COVID. And even friends of mine who aren't, in the medical field, and they say, really, how serious is this? And then, I share my experiences and I'm saying, trust me, this is 100% real, and please take this seriously. And all you can do is just educate them, and just share your experiences, because your goal shouldn't be to change someone's mind, because people are going to make their mind up about, about everything. But education is great, and then just sharing your experiences. But from what everyone who is coming to the hospital is taking it very seriously, mostly because we are, enforcing everyone has to wear masks at all times. We're promoting, social distancing at 6 feet. So everyone is taking this pretty seriously, which is really reassuring, because we're working so hard and we don't want to see more people get sick with this. So yeah.
Wonderful. Anybody else with any thoughts on that question?
I would say I agree with that. I feel like, especially like coming from the ICU, like if you're in the ICU with COVID, like we're past the point of this isn't real. Like when patients are breathing 30 to 40 times a minute, they can't catch their breath, their O2 sats are in the 70s or 80s. I haven't had anyone argue with me at that point that it isn't real, thankfully.
Wonderful. Well, that leads to another question that one of the attendees asked that kind of goes into this. You guys are on the front line with COVID patients, being exposed to these individuals on a daily basis. And until recently, we have not had a vaccine to prevent us from getting this. How have your families dealt with you caring for and being, the direct provider for COVID patients?
I feel like for me personally, I have the fortunate opportunity where I do not live at my parents' house. If I did, I feel like I would have probably isolated myself from them. But it's definitely caused them a lot of fear. And when I would tell them I'm being floated to COVID units, or I would have a COVID patient, they would be extremely fearful and be like, do you have PPE for tonight? Do you have this? Do you have that? And I think it's caused them a lot of panic, because you feel, even though you have the mask, you have the face shield, you have the gown, like there's still a sense of nervousness. And even when this first started, you hear this as, this is a deadly virus. Okay, go into your patient's room. So it's like a lot of panic, and especially from families. And I wasn't able to see my family for a while. I still am like apprehensive about seeing them from time to time. Same thing with my grandparents. Like I've been trying to keep my distance from them as well, which is definitely hard. And it definitely doesn't help with feeling like a sense of community and things, because you can't really see people or hang out with people. But yeah, it's just been more difficult in that sense.
Yeah, I would agree. Like I mentioned before, my sister, my mom, they also worked through the pandemic. So we were all working with COVID patients. But even, being around my stepdad and stuff. And honestly, when you're working with, 2 masks on, and you're like with this gown and you're just constantly running around, you get dehydrated. Like there's no time to drink water, or really you're just snacking here and there. So after, a few shifts and you're off for a day, you just don't feel great. And you're like, oh my God, do I have COVID? Was I exposed? And then, but then it could really just be you're exhausted and you're dehydrated. But yeah, it was really just, especially my mom and stuff, you hear stories of people who came in, or older people who came in, and they were exposed to their family members, and you just don't want to get your family or friends sick. So when the vaccine came out, I was, obviously I got it because I wouldn't want to expose, anybody to it with comorbidities. But I'm definitely just like practicing really good PPE and infection control, and then just keeping distance, even though it was really tough. The importance of it just, overtook everything.
I actually have a question for you, and then we'll go to the final question before we move on to the next panelist. But we sent out a movie from the New York Times for many individuals to to view before the event tonight. And one of the things that was brought up that really moved me at the end was a nurse who dedicated her life to caring for critically ill patients. And through caring for these patients, through COVID and the grief that she's experienced, she's questioning herself. Did I make the right decision? Can I continue on as a nurse? Is this the right profession for me? What has this, I mean, you guys have been so honest with us with what has happened. Like Jasmine, what you just said, I really appreciate you saying that, it is scary saying, was I exposed to a COVID patient and so forth? Could I make a family member ill and so forth? Has this just strengthened your resolve in nursing, or has it given you pause thinking, well, maybe I shouldn't be an ICU nurse. Maybe I need a different setting. Or are you just taking it day by day?
I would not do anything differently. Knowing what I know now, if I went back, I would do it all again. I would still work in the medical ICU. There's really nowhere else I'd rather be.
I agree. I agree. So like I said, I oriented in the cardiac ICU, and that is eventually where I want to end up. I'm hoping within the next few months I can find my way back. But I will say, at first floating, I totally hated it. And I said, is this really what I want to do? Like, is this what I came in wanting to do? But it's really been a blessing, because I have to say, my respect for different specialties, low level med surge, caring for 5 to 6 patients, not having a doctor on the unit, and you are basically just trying to keep them stable until a doctor comes. Yeah, my respect for other nurses, new nurses, older nurses, and just the profession has just made me very grateful to be a nurse, especially in this time. I mean, it's come with hardships, but I think that pride has been the thing that I'm feeling the most coming, still in this pandemic, and then hopefully coming out of it fairly soon.
I agree with them as well. I wouldn't change anything. I really love the unique opportunity of working in pediatrics in the ICU and nursing overall. And I think you have to make sure you prevent that burnout from the start, because it's easy to get in your head and get burned out as a nurse and really question if it's something that's right for you. And I think you deep down know, even when you have those really rough shifts, that like, I can do this. Like, I am meant to be a nurse. I know I can take care of people. I know they need me. So I think you have to make sure that you prevent that burnout from the start, because then it can get kind of slippery as to feeling and having those like self-doubts. But I definitely love nursing, and this pandemic really frustrated and pushed my boundaries as a nurse, but at the same time it strengthened that I know that this is what I want to do.
Wow, that's so, it's powerful. I mean, it moves me. Is there any strategies you used? I mean, the stress that you're dealing with is unimaginable, with the grief and just patient, everything. But also, when you were in nursing school, there was a tremendous amount of stress as well. About the unknown. Are there any strategies that you used in nursing school that also served you well now? Because we have most of the attendees are nursing students, and that would be wonderful, that coping skills that you use now that would be beneficial for them now.
I think a coping skill that everyone hears and you talk about: eat right, make sure you're getting enough sleep, make sure you are getting some sort of like physical activity. But another thing, and especially as a night shift nurse during the winter months, I didn't see the sun. So I think just taking in those little moments, like a sunny day outside, like making sure you just like appreciate the weather or take joy in those small moments. Like if you have a family pet, or if you have a favorite TV show or a favorite musician or something, like take the small things that you love and appreciate and use them, or like incorporate them into your life more than before. So I would say continue doing what you do now that you love best, and don't lose that. And I think especially in isolation, we haven't had a lot of opportunities for going out and doing things as much as we would like to. So you have to find little things that really bring you joy that you can incorporate into your everyday life to make sure that you don't go crazy.
Yeah, I just want to, sorry, Erin, do you want to go?
No, go ahead.
Okay, sorry, really quick. I completely agree with Sarah. I think just the biggest thing, so working and going to school, both stressful in very different ways. I think that just know that your mental health is the most important, and to know your boundaries. Transitioning from school to work, you're not going to get everything done. You know, it's great to do, like, you want to do the most and do the most for your patients, and also to, like, you know, be prepared for the oncoming shift. But you have to be able to ask for help. It doesn't mean that you're less of a nurse. You have to ask questions, ask for help, and then just know that if everything doesn't get done, it's going to be okay, because it's a team effort. Especially during this time, you have to like rely and lean on the people around you. Go ahead, Erin.
Yeah, I agree with what both of you said. And nursing school teaches you in some way or another how to manage your time wisely and be smart about that. And it's still so important, like while you're at work, like going back to the first question, like there's no such thing as a typical day. Whatever can go wrong will probably go wrong, and you need to be able to just like plan for that. Like when I go into work, I do everything that I can possibly do, like right off the bat, so that like when something inevitably like goes haywire later on, like I've created time for myself to be able to deal with that situation, and it just eliminates stress like later on in the shift. So you learn it in nursing school and take it with you like when you start working.
Wonderful. Thank you so much. Okay, another question coming in. These are great. What would you recommend to best transition from student nurse to graduate nurse? It's a tough one.
That is a tough question, but it's a good question, because it's hard, because when you're still coming in, they still see you as like a baby. They still see you. They know that you don't know, like, you know, the bare minimum. So, you know, your preceptors and people who are working on your unit, they are more sympathetic, and they'll help you. My recommendation is just to really like push yourself, and you know, along with asking for help and asking questions, have confidence in, like, stop, think about what you're doing. I can do this, and then find out what you don't know, and then, you know, then ask questions. But just like you coming out of nursing school, you know more than you think. And so just to have confidence in that, and yeah, just work hard.
I completely agree. And I think it's a huge factor as a new nurse to ask as many questions as you can. And even though you may feel dumb or you may feel like you're sounding annoying, there's nothing scarier than a nurse who has false confidence and just does stuff. And especially as a coworker. So it's important to make sure you're constantly asking those questions, and people understand that you will have questions and you're new. Or take those opportunities. I would say, being a new nurse, IV practice is something not a lot of people probably have, or certain nursing techniques. So I say go to people and say, hey, I heard you need an IV in that room. How about I help you with it? Or can I watch you do this? Or can you explain to me what this is? You can talk to like other staff members, like respiratory care and OTPT, like what do they do? What can I do as a nurse to assist you? And people will love you for that. And it definitely helps create communication between your colleagues in different specialties, which I think helps you ultimately understand more as a nurse and provide the best patient care at the same time.
Wow, that's wonderful, wonderful advice. That's going to help a lot of new grads coming up in May and August. Okay, why don't we do our last question? And I think it's a wonderful way to wrap up this panel. What is your proudest moment as a nurse during the pandemic?
I think my proudest moment, I actually was nominated for a Daisy Award. And for me in nursing school, that was like my dream. Also, because who doesn't want like a cool pin for their badge? But my biggest thing, because that's from like a patient or family member. So to me, like that's what I care about, because I could get the best lab results in the world, or you could get the best oxygen saturations. But the stuff that makes you feel like you really did your job as a nurse is hearing positive feedback from your patients. And I think that was the biggest thing for me. And that was a big moment for me, realizing like, I'm going to be a good nurse. Like I still have a lot to learn. I still have a lot to do, but I'm on some sort of right path. And it's definitely good having positive feedback from such a like trying time.
Thank you, Sarah. Thank you. Anybody else? Erin or Yasmin, anything to share with that? Or I don't want to put you on the spot.
When I think about it, there's not like one experience that I've had that, I mean, Daisy Award is awesome. I think, I mean, you know, when you come to, with me floating, coming to different floors and stuff, and then you see your team coming on, they're like, oh, you're with us tonight. Oh, like, I love when you work with us. You do such great work. Hearing that, like knowing that they recognize you, they remember you, and they enjoy working with you is awesome. I mean, and then also just kind of reflecting on where I started to now where I am. I'm coming up on my 1 year in July, and to just now, like in situations where I have a patient that's rapidly declining, you know, knowing what I have to do, like the basic steps until the doctor comes, or knowing when, you know, knowing what to do and staying calm and, you know, trying to make my patient feel as safe and safe as possible. But yeah, just reflecting on how far I've come has been probably the proudest thing for me, because I've worked, you know, you work really hard as a new nurse. All you want to do is just do right by your patients. And yeah.
Yeah, I agree with that. I don't think there's one like moment that I particularly had that I can say I was proud of, but realizing that not even a year ago, I was on my first night off orientation, terrified that I was going to kill somebody, to now, like when patients are decompensating, like I'm one of the people in the room, like at the bedside, doing like what I know needs to be done and doing it half decently. It's just like a really good feeling just to see how, you know, I've evolved in not even a year. And then like being able to build rapport with these patients, because, you know, as we all said, it's so hard being able to like psychosocially manage everyone. So then like building rapport with like these really sick, scared patients and their families, and like knowing that they feel good like when they talk to you is a really good feeling as well.
Wow. Thank you so much, everybody. For the purpose of tonight, when we were developing the symposium, was to be able to share the lived experience of a new nurse during COVID-19. And I think we achieved that with the panel. And on behalf of Moravian, Cedar Crest, and DeSales, I would like to say that we would like to give you our sincerest gratitude, and that you truly inspire us for what you have done over this past year. And we are just so, so thankful. And thank you for participating tonight and being so, so honest with all our nursing students that will and have benefited from your stories tonight. So thank you so, so much. Any other thoughts, or are we going to pass it off to Dr. Rob to introduce the next panel? Thank you, ladies.
Yeah.
Thank you, Yasmin.
Thank you so much.
Thank you. So
Thank
I'll
you.
just echo, you know, what Dr. Berniker said. You really have all inspired inspired all of us. You are the future of nursing, and the future is bright. So we're very excited. Thank you again for a powerful and inspiring discussion and for sharing your experiences with us. So the second component of our evening event this evening shifts the focus from our newly licensed novice nurses on the front line to the academic faculty who prepared them. These nurse educators also assume a huge charge, the responsibility for educating the next generation of nurses. Nurses who have accepted their position in the unknown. Responding to the dramatic changes in academia while ensuring that successful student outcome, our expert nurse educators have become the masters of pivot, right? Pivot is the word for 2020 in academia. So I'm very interested to hear all of their stories as well. I'm thrilled to welcome and introduce our distinguished nursing educators, my colleagues, Professor Sandra Axt from Cedar Crest College, Dr. Elise Kolincheko from Moravian College, and Dr. Deborah Whitaker from DeSales University. This discussion will be moderated by Dr. Mayanne Pasquale from Cedar Crest College and Dr. Tricia Berniker from DeSales University.
Okay. Hi, everyone. I'm just checking my mic. I guess mic check. I don't know. Video check. I can see me. I hope you can see and hear me as well. And I would just like to echo the fantastic job our nursing alumni had just done in that discussion. I mean, I'm almost speechless. It is, and I have to watch it again because I'm nervous about this next discussion. So I don't know if I'm really paying 100% attention to all the unbelievable things they said. But thank you so much for sharing all of your insight and wisdom and experiences during this most crazy year. So yes, thank you, faculty colleagues, for agreeing to come in and discuss and share your experiences as well. We all know when classes came to a halt in March 2020, I remember thinking, you know, when they suspended the NCAA basketball, you know, the tournament, I thought this is getting serious. And then no sooner was that suspended did, you know, our college campuses close. And as faculty, we had to scramble and redesign our courses to virtual online experiences, not only theoretically, which was not that bad, but really and truly doing our clinical experiences at that time was quite crazy. So we did it in the spring. Faculty continued to redesign and do courses in the summer. We continued to do it in the fall, and we did it in the spring. And hopefully the cycle is not continuing, but we are still faced with a lot of challenges. So thank you. And I'm going to as well ask you some questions, just as our previous panel did. Our panel discussion was led, and we want to hear from your experiences and wisdom and how we can continue to move forward in this pandemic. So my first question would be, so as faculty, our primary role is not providing direct care, but rather it is developing and supporting those who are and will. And our graduates are a testament of this. How has the pandemic impacted the way you work and approach your teaching? Not only, I guess, in the spring, but how it continues to impact you today as well.
Okay, I guess I'll jump in. I'll go first. Pivot's a great word. When this happened, I think like mostly everyone, we thought this was going to be over in a few months. We thought this is not going to be that bad. Everyone will wear their mask as soon as we knew that would help. And we won't see this become a year-long or longer process. So I think that was the first thing that we had to realize, the challenge that if this went on more than a couple of weeks, what were we going to do? I think the second piece we had to think about was how our students and our faculty experienced this pandemic very differently and very uniquely. that how I was feeling one day was not necessarily how my colleagues were feeling or how my students were feeling. And realizing that unique experience, I think as an educator, you really had to take pause and you had to think about, how can I support each of these different roles, the student and your faculty and yourself, of course, being, the nurse that we are, we try to remember ourselves at the end of the equation, which we should be a little bit earlier. So I think for us, we realized we needed each other and we needed to work together and brainstorm quickly. And we were fortunate, we had a lot of technology already in place that we could use, but maybe weren't using fully. So we quickly became experts in Zoom and in doing simulations in different ways that we weren't actually in front of our students. I remember when we came up with a telehealth idea, and we're like, ooh, we're seeing patients in telehealth. We could do this, can't we? Let's do this in simulation. And jumped in with getting our standardized patients and making scenarios. And it was countless hours by the faculty who did this. I'm still in awe how it all came together so well. But boy, they were working evenings and weekends, and we were phone calling each other all the time, and just hours of talking and planning. But I think that challenge made us realize that, well, as difficult it was and scary as faculty for this, we also knew that we could give the students what they needed, that we still had a way of teaching them the importance of what they had to know. And maybe now it was more what's nice to know and what you need to really know. And I think we all prioritized a little bit. We pivoted, we shifted, we tried these new things, and we kind of dove in there saying to them, yes, this is not ideal. This is horrible. Many of them were losing family members to the disease, and many deaths. And I was in awe how the students kept it together. And the things that, when we heard what they were going through, and only if they shared it with us, which was the other part, we didn't always know what they were doing. They were worried about financial support. They were working and trying to keep their families afloat and helping, and while being full-time nursing students. So their experience was even more stressful than ours. I think as educators and in nursing especially, we love our students. We hold them close. We feel like they're our extended family children, and that we're so responsible for them getting what they need. So it was hard because we took on that, I want to say, like mother and father type of role in our minds. They don't see this, but this is how we feel. And then said, okay, we can give them this, but then to realize that maybe they weren't ready to receive it. And then we realized about Zoom fatigue. And, why don't they look excited? This is like such a fun topic. I love this. And I'm an OB nurse. So I'm just like, oh, I've got the pelvis. And I usually walk around class and I'm talking with my hands. And now I can't do that. And I'm looking at them and they're just looking like, oh, and I'm thinking, oh, what can I do to make this better? I think that was really hard as an educator. And then once we found our rhythm, I think, and gave them more breaks, and we get a little more interactive as best we could, and bring that enthusiasm and support. And we hear you. Do you hear us too? It was challenging. It really was.
I think that really the approach became, the two words became not only pivot, but flexibility and patience. And that's what I would constantly tell the students. This is going to be all about flexibility and patience. Patience with the technology, that we were learning, some of our new technology, flexibility in, if they had kids at home or if they were ill, doing things like that. And then I think just staying strong for the students, because I remember being really stressed trying to get my course ready for summer that was going to be fully online, a senior complex health course, which is really, a lot about clinical stories. So, not letting them see the stress and trying to stay strong for them and letting them know that we were going to give them what they needed to be graduates, I have to say, I'm so proud of Erin. Erin was one of my students. I'm so proud to hear her talk, you know, and bringing in stories. I still work at the bedside, so bringing in stories for them that can show them, you know, live patient stories so they can have something to hang their hat on, but really just trying to stay strong for them and letting them know that they were going to be okay. We would get them to where they needed to be. And I think we did that.
So I would agree with both Sandra and Deborah, and it was so much flexibility on everyone's part. And I think for me, it was acknowledging the students' flexibility and acknowledging that this is hard and you all are doing well. And, you know, when you have students who, you know, are struggling because it was anxiety producing. I mean, going to the grocery store was so anxiety producing in early April, like just that act, let alone trying to sit on Zoom for 6, 7, 8 hours a day. And then, you know, your family members are coming in and I'm getting hit in the head with stuffed animals while I'm trying to teach you about X, Y, and Z and trying to keep a straight face, but you all are laughing. So at least you were paying attention for that moment. But it was really hard. And that for me, that was my moment to kind of just recognize the strength of the student and just, wow, like this is tough. I'm not sure if I was on the other side, if I'd be able to pay attention. So how can I be real in what's happening right now? And how can I keep the bar high, but change my expectations on how we achieve that bar? And, you know, because some students had to start working and that's just, it was a reality. Like, you know, I'm home now and there's more bills or, you know, somebody might lose a job, so I have to go to work, or somebody did lose a job, and that's hard. And, you know, to be flexible in those moments to allow your students to still progress and to still grow without feeling bad about the decision they made. I think that was important. The other thing was just so much creating. Wow, as an educator, I felt like I was creating every day, if not, you know, every moment, within the moment, just trying to create scenarios and, you know, learning opportunities. I did find it interesting though, like I was super honed in on what our objectives were. And maybe I shouldn't say that out loud, but I mean, like more so than I think I've ever been as an educator. And it's not that I don't pay, obviously they're important and that's what we use to guide ourselves, but I was so honed in on, I want to achieve this, this, and this right now in this moment for this clinical, because I have 8 hours of clinical that I need to make sure we're not just, you know, tooling away, doing whatever. I want to make sure it's purposeful and it's meaningful and you will grow from this. So then when we get back in the hospital, you're ready to apply this. You know, and I can't say it was perfect all the time because that would be a lie. There were some misses along the way, and I appreciate my students' flexibility with me and their patience with me, because there were moments when it was hard on my end. It didn't always, you know, it didn't always come across perfection, but that was, it definitely impacted me, and I think it will, not I think, it will impact me forever, because it will forever have taught me that you can be flexible and you can, you know, pay attention to things and not to be hard and fast on certain things, because the important aspect is, did we learn and what did we learn and are we growing? And I think that this highlighted that like just tenfold.
Thank you so much. I don't know if I probably just keep sitting here and nodding because I agree with like everything that you are all saying. The word flexibility, which is not often something we support in nursing curriculum and in nursing clinical. I mean, we are rigid and we have to meet, you know, all of our objectives, and we have to meet, you know, all of our clinical points in our clinical evaluation. So flexibility is funny. I think that is coming out. And so you're all hitting on this a little bit, but if you had to say, what has been the most challenging thing for you, but what have you found the most rewarding? If you can kind of point to that, if you can share that with us as well.
I think it was really challenging, especially in the summer when we were fully online, no clinical, we weren't at the college at all in a lab. It was challenging finding clinical experiences that were worthwhile for the students, that we weren't just throwing something to meet an objective, but that was going to be boring sitting on a computer all day. For me, that was stressful because I really wanted to give them something that was worthwhile. And then on the opposite side of that, at the end, the most rewarding was when they said that they actually learned from a virtual simulation that I found for them. And, they could tell me all the ways that they were learning and how they would be able to apply it. So that was really rewarding that we got through, and I felt that I did make a difference for them, that it wasn't just throwing them something that we put together, that they were all worthwhile assignments, and the students learned from it and they were able to meet their objectives.
I think similar to Sandra's, the technology piece was challenging in the beginning, trying to, and even to this day, sometimes, you have 60 people on a Zoom and something happens and can you hear me, or they're gone, or what did I click? Those things still can happen. And that was, I think, the clinical for sure. I think with us, the piece that gave me a lot of hope and seemed to be the most rewarding was when we actually did the simulation use that I described, that kind of telehealth thing, and they were actors and they were in their homes because nobody could be together. So the fact that, like, when that came together, I remember watching a couple of the students, because we would record it so we could look at it later and debrief. And I remember watching this one student, and the patient said something totally unexpected. And I knew the students were nervous because they were worried about the technology, and they're just like we are, playing with our cameras, making sure it's okay. And she sat there, and I remember her looking down at her notes and saying, okay, well, I think it could be, and started to she forgot that this was an actor, and she truly answered and made suggestions and asked more detailed questions. And I sat there and I was like, oh, the aha moment that we always hope our students get, to actually see it, because I'm not always with them in the clinical setting in the room when something happens. I just remember, like, fanning myself, like thinking I was going to cry, because it was such a great moment and such a response that I thought, they're getting it still. Like, they're getting it. This is going to work, or something. It's going to help. And I told the student in debrief, I was so proud of you. You just did so amazing with that. That was just like a wrench thrown in. And the student had no clue how well she did, and just looked at me and said, did I thought I did terrible. I was like, no, I'm so proud of you. So I think, like, those moments as an educator and being able to share that with the student was so rewarding. And the fact that they wanted to get back to clinical, they didn't run. There was a few that were scared, and similar to what Dr. Ralph said in the beginning, I was an 80s nurse grad. So I remember HIV, I remember the scare. We didn't know how it was transmitted. And I said to them, I know how you're feeling because I lived it. It was in that. But we do know how this is transmitted now. We know what we need. We can keep you safe. You can keep yourself safe. You can keep your patients safe. So trying to give that excitement of, we know more. I get it. I understand where you're at, but let's, kind of push through this together. I think that was really rewarding, that when they said, when can we get in clinical? We want to go. I'm going to get my N95 fitted today. Can we go? Can we go? They didn't run away. And that's why I know our nursing students here, they're gonna be prepared, and they're gonna take great care of us. And as I joke, I want to retire someday. I want them to take care of me and my family well, so I can retire. And and I know they will. And hearing the three the students, the new nurse, not even students anymore, the new nurses that were speaking, representing our different programs. What what an honor to know that they're out there doing what they're doing. And so I think that's really rewarding from our point.
I would say the most challenging thing for me during this time, especially last April and May and this December, January, is just my home, like being home with all my kids, and then trying to be functional and professional and having to maintain that, not having to, but wanting to maintain that energy that you bring to the classroom. Like, I'm all about energy. And if it's flat in the classroom, you know, who wants to be there really? So that was personally a challenge for me because, you know, I was feeling this weight of just all the responsibilities from home because it was what it was. And, you know, we had to manage it. And that was really challenging. So trying to protect my energy. So, you know, I started exercising more than I think I ever did in my life, and, you know, trying to hydrate and focus on what we all like ate, and, you know, having no screen time, and, you know, what kind of things can we do? And that took a lot of planning as well, because I had a plan for home. Okay, here's what we're doing for the day. Because if you don't have a schedule and you have small kids, well, forget life. Nothing else is going to happen. And then trying to make sure that I had the energy to bring to the classroom, even though like 5 seconds before I unmuted, my children were screaming at me like hard. But now we're ready to learn. So, and it's not fake. And I don't want anyone to think that, because it's not. It's real. Like, I really want to be this way, because that's how I feel people learn best, is when I'm excited about the content. They're going to be excited about the content, or maybe I could like stir them to feel excited about the content. So that, for me, that was my biggest challenge. And you know, you keep trying different things. You know, people give suggestions, and you try things, and you keep moving forward. I haven't found the magic thing yet, but I'll tell you if I do. Most rewarding, I think, just to kind of exactly what you all are saying, but it was impressive to me. You know, I could speak for the seniors because that's what I had this last fall. Like, our seniors, they just came up and they just went right onto those units, and it was phenomenal. All the clinical instructors were like, well, they haven't missed a beat. Like, they just right back into it. Like, and, you know, we were, you know, uniquely challenged at Moravian because of our fall and spring into the pandemic. We were off the unit more than, you know, we wanted to be. And I'm just, and I told you all this because it's true it's just impressive how much you must have spent time thinking about your clinical skills, because there's no way you could have not thought about stuff and walked onto the clinical unit and been that just engaged and that focused on your learning, and how excited you all were. And we just really wanted to get you on the unit so you could just demonstrate those skills. And so because that's what we want. We all want to graduate nurses who we want to take care of us. And we're like, yeah, that's our goal, you know, to get you ready to do that. And, you know, we still have work to do in that department, but we keep trying. So that was my proudest and most rewarding moment.
Thank you so much. And that is collectively across all of our institutions. I mean, you can see we were all faced with the similar challenges, and we have the similar rewards. I have been in practicum this right now in this semester, and every time, like, I've seen my students on the floors or I have heard from them, the word resilience, you know, I know it's like a cliche term. I feel like everyone needs to be resilient, but the resilience they show, you know, and the compassion and the work ethic, it makes me feel good. And I think I hope we're doing a good job. And thank you for sharing your honesty, because our students are on, you know, on the symposium. And I think it's important for them to see that, yes, we've also, of course, had, you know, these challenges, but we've tried our best, you know, to help graduate you to becoming, you know, the best nurse possible, so that you can take care of us. I love that, Dr. Whitaker, because I always say that as well. You know, I'm getting old, and I hope you're going to be out there and you're going to be able to take care of me, you know, because I'm going to need you. So thank you. Now, I know there are some excellent questions I heard in the question and answer. So I'm going to turn this over to Dr. Berniker, and there she is. She has some questions for you as well.
Hi, everyone. Thank you so much for being so honest and so transparent with our students. That's what tonight was about. It was about sharing these experiences and let them know what we've been going through. And we did get some difficult questions. And as I was reading, preparing for this, it kind of weighed on my heart. But these are good questions and these are the concerns that they have. So hopefully we can address it. So the first question is, COVID-19 is not going away and student nurses are not getting the experiences caring for patients on aerosolizing procedures, vents, trachs, due to the COVID precautions. What are your thoughts about students not being able to get the practice caring for these patients that they will care for in a few short months? And I know from talking, I teach critical care at DeSales, and it weighs on me every day. We are concerned. Does anybody want to elaborate on, I mean, I know deep in my heart that they are prepared and so forth, but it's not just enough to say, oh, you're good, don't worry about it. So yes, I would love your thoughts.
Yeah, I'm going to jump right on that one, Tricia, because I truly believe that is a concern. And I felt that as a new grad also. And I think by hearing the nurses that spoke to you who have been out for a year, you heard that even without the pandemic, they had part of the pandemic. When they got out there, they realized there was a lot of skills that they were not going to feel confident with until they did it several times. And I think you can rest assured, you understand respiratory, you understand oxygenation, you understand the signs when your patient's going to fail or is failing. You know what you're watching for. The actual skill, while it's scary because you haven't touched the equipment or played with it enough, played, you know what I mean? It's going to be like riding a bike. You're going to do it a couple times, play with it, maneuver it, and then you're going to like, oh, that wasn't so bad. And you're never on your own. You are going to have orientation for weeks and practice in skills labs. And you're going to have a nurse at your side saying, that's right. No, don't touch that. Remember about your technique and asepsis. And you are never alone. Please do not lose sleep over that. And even as experienced nurses, there's times when we've had a ton of experience. And I remember with one of my students, we were out of the OB unit, we're passing an NG tube for somebody who had an ileus after a C-section. And we went to hook it up to the suction, and guess what? The piece was missing that was supposed to go between that and the suction container. And we're looking around, the students and the patient's vomiting, like, what do we do? And I'm like, well, we know the principle. And we literally put it together, taped it around for a second, and the suction started working. We're like, called for help, got that piece, put the piece in, replaced it, and everything was fine. But we knew it was important, and we knew we could kind of what's the term, MacGyver, they say, you kind of MacGyver it a little bit. But not everything goes perfect, even when you've done things many, many times. So I totally understand it. I remember being fearful the first time doing a code and things like that. But you will be in good hands, and you know more than you think you know. That is so true. I think Yasmin said that one, and I truly believe it. So but it's a real concern. I do get it. I definitely get that.
Well, Sandra and Elise, could I give you we have two additional questions and I want to make sure we get to them. So can I give each of you a difficult question? And okay, as nurse educators, do you feel that the students now may have been more difficulty picking up topics and skills versus previous nursing students pre-COVID?
I don't know, Sandra, do you want that one? You can have it.
Go ahead.
Okay. Topics and skills. I'm not sure it's topics and skills as opposed to attention. I feel like when we're in the lab and we're doing things, we're getting it, we're doing it. I mean, we're going through it and we're talking about it. I think attention is hard because if you're on Zoom, there's so much distraction. Like you have your email open and you're finishing something in this class. And I mean, I'd be insane to think that's not happening. So that's why you have to be like super engaging or put people in breakout rooms. Now you have to do stuff, right? But I don't necessarily think it's harder for them to pick up concepts or skills. It's more of how do we grab the attention? And I don't, and be quick with it. Like, here's the quick. And okay, now let's practice it. Okay, now let's go back. What did we hear out of that quick little discussion? Okay, now we're gonna do it a third time. I mean, very few of us hear something once and we remember it forever. I mean, that's just amazing if you had that skill. So I don't necessarily believe that. And I also believe during this pandemic, and that goes to attention, there was so much out here happening that it was really hard to attend. Because I'm not saying the attention is just the lack of desire to attend. There was a lot happening. Every week there in March, April was like week to week, we didn't know what was happening. And that makes it hard to attend to something. So I don't know. I would say no to that. I would say no to that.
Thank you, Elise. That's wonderful. And Sandra, I have one difficult question for you, and I think it's a great question. I really applaud our attendees and our students for putting these questions out there. I know these are questions that have been going through your mind. And, when we're in the front of the classroom teaching, it's hard to come up to us and ask it. So I thank the three of you for being so honest and transparent with these. But another difficult one. Do you feel as though you have lowered your expectations for students or nursing faculty in general being more lenient due to the limited experience we have had? Have we lowered our expectations of our students?
Absolutely not.
I agree.
I mean, I can say that right off the bat. No, I think we might have to find a different way to get to point C, instead of going A and B, we might have to do something a little differently. I don't think that we've lowered our expectations at all. We might have needed a little more flexibility of how to get there, but the students need to understand they have a very important role. They are caring for a human being. And even if it's starting at the basics, the basics of nursing care, they have to do that in an excellent way. Each and every time that they're with somebody, because I tell them the person you're taking care of is somebody, and that might be your family member. So, there are things we cannot lower the expectations. We might just have to find a different way to go about getting the student there. And even the question before, I haven't found that the students have had a harder time. Like in a way, I thought, were they even, I don't want to say excited about COVID, but did the showing of how a nurse is and the importance of nursing, did that excite them in the career that they've chosen, which made them more excited and, energetic maybe to complete their education? So I was really proud of our students, kind of expecting that they were going to be a little rusty, when they were out of the clinical area, but I was surprised they did an excellent job, and I was really happy and proud of all of them. So I hope that answered the question.
It did. Thank you. And I apologize if I seem to rush the three of you. I wish we had another half an hour to discuss with the three of you these important questions that the students have. But it's time now to have Dr. Pasquale introduce our next section, which is our wellness section. So Dr. Pasquale?
Yes, thank you. Thank you, faculty panelists. This was so rich and enlightening, and I hope helpful for our students and everyone else to hear. So without further ado, you all hear us all the time. Students, we're always saying as nurses, we are devoted to helping others, but we also have to make sure that we take care of ourselves. We cannot take care of others if our tank is empty. So it gives me great pleasure at this time to welcome our esteemed mental health faculty from our collaborative institutions, Dr. Pam Adamczyk, Dr. Todd Hastings, and Professor Karen Peterson. And they are going to share some self-care wellness nuggets, we've been calling it nuggets, to help maintain good mental and physical health now and as we move forward and hopefully out of this pandemic. So welcome, faculty. Thank you.
Thank you so much. This has been a great presentation this evening. And as our new nurses said, self-care is very important. So, and nurses, we often kind of zoom out at that particular moment or go someplace else. So don't turn off your Zoom right now, because this is the next 20 minutes. We're going to talk more about self-care and actually do some practice on how to do that. The first thing that we're going to do is a body scan, which is a mindfulness exercise, but it is a simple way to check in and see how we're doing now, what's going on in this particular moment. So I want to start with a quick body scan for all of us. So what I want you to do first is to take a deep breath in and breathe out. Breathe in and breathe out. Now I want you to pay attention to your feet and your ankles. There isn't anything to do other than to just notice how they feel. Are they tight in their shoes? Are you tired and uncomfortable? Or do you feel comfortable and relaxed? Again, no need to do anything about it. Just pay attention to how you feel. Pay attention to your legs and your thighs. Do you feel any spots that hurt? Or are you comfortable and relaxed? Do you feel pressure against the chair? Are you hot or cold? Pay attention to your knees. No need to do anything about it. Just pay attention to how it feels. Pay attention to your hips and your back. Notice anything that's uncomfortable, or you feel calm and relaxed at this moment. Pay attention to your abdomen and your lower back. Do you feel the pressure against the chair? Are you tired from working today? Or do you feel comfortable and relaxed? As you continue to breathe in and out, feel the breath in your chest. Feel the rise and fall as you take each breath in and breathe out. Do you feel any tightness? Or do you feel comfortable, relaxed? Any pain? Pay attention to your upper back and shoulders. Are they stiff from working? Notice anything that might seem different or out in the ordinary for you. Pay attention to your arms and your legs and your hands. Is there anything that you notice? Do they hurt? Do they feel comfortable? Or are you calm? Pay attention to your neck. Do you feel tension? Do you feel stressed? Pay attention to your head. Do you have a headache? Do you feel uncomfortable? Or do you feel calm, cool, and relaxed? No need to do anything about it. Just pay attention to how you feel. As you continue to breathe in and out, take another breath in, and as it flows through your body, pay attention to any place in your body that you didn't notice before. Any tension, any tightness. No need to do anything about it. Just pay attention to how that feels. And as you finish that quick body scan, take another deep breath in and out, and return to your presence here at this session.
Thank you, Karen, for that body awareness and soothing breathing. And I'm going to ask for a minute for you to think about, well, why all the emphasis on self-care? Obviously, it's come up that that's really important for all of us to maintain our psychological integrity. But I also want you to realize for a moment how much you have been exposed to stress, and in addition to secondary traumatization. And as with many types of trauma, we realize that we need to sort out or consider changing what you can versus what you can't. And so what are some of the essentials of self-care? Well, a couple of things that we encourage you to look at are to ask yourself, what makes you feel whole? What is it that you really strive to find to make yourself feel whole? And what contributes to a peaceful existence for you? And if you're not sure about these answers, or if you're not confident in answering these questions, we encourage you to try something that we're presenting tonight to add to your repertoire of self-care.
Okay, so for everybody to expand upon these themes, let's look at self-care on a continuum for a moment, thinking about the human dimensions, mind, body, and spirit. First, let's consider the mind. And an important element of emotional intelligence that's a consideration for a mindful approach. Think about giving yourself permission to let go, permission to let go of past and future concerns, which is challenging. We're not socialized to do that. It is hard, but it is a choice. And it is something that when practiced, you realize that you have power over. You are empowered to be able to achieve a mindful presence. The wise mind seeks the middle, the center, the place where you can go. And if you consider some of the things that you felt with your body during the body scan, now you expand this in another way with the mind. Think about a mindful exercise, okay? And for you to imagine a place, a safe place, a preferred space, and for some, maybe that happy place. And in doing so, think about considering, and it's easier if you close your eyes, what that is like. As much as you were in touch with your body sensations before during the body scan, think about this place that you go to. Think about it from the standpoint of the sounds. What does it sound like? Imagine that for a moment, for that place. And it's different for different people. Hence, those landscapes on the slide just give some possibilities, but it's very subjective. What does it sound like? Then think about the sights, the appearance. What does it look like? You're tapping into perceptions, but now perceptions of recalled memory and your impressions that are in your mind, but that evoke responses, even in a very somatic or kinesthetic way. What does it smell like even? Fully embracing your sensory perceptions from something that you have saved in memory, something that you value and you sought as a peaceful place or center for you. And then consider the emotion. How does it feel? Tapping into that feeling of that special place. It's soothing. What does it feel like to you? How does that ability to give yourself permission to go there, to practice that response, help you to gain that grounded or centered posture that you can evoke, again with practice, wherever you are in space? Just as imagining that type of experience. So that's a extended mindful exercise that goes a bit beyond the scan. And now we're going to look at then augmenting other more body or kinesthetic types of themes, and then we'll move on to the spirit.
So thanks, Todd. I think that's so important for us to remember to do the mindfulness kinds of exercises. But not everybody feels good at doing things for your mind, and there's a reason for that. some people get their tension in their body versus their mind, and some people are worriers. And some of us, unfortunately, get tension in our bodies and we worry. So we want to think about exercises for the body, especially if you have problems with body kinds of issues with tension. The first one I'm going to share with you is a progressive muscle relaxation. Now, of course, we don't have a lot of time, so I'm going to do one muscle group, and you can do it for every muscle group in the body. But for a moment, we're going to focus on our shoulders because most of us have tension in our shoulders. So what I want you to all do now is just shrug your shoulders all up as if you're reaching your shoulders towards your ears and feel the tension there. Okay, so I don't get to see what you look like, but you can certainly see me on my screen, scrunching up my shoulders. Once you get them scrunched up, hold them, feel what that feels like to be tense. And then I want you to drop them back and bring them down as far as you can and feel the difference. And let's do that one more time. Shrug them all up, feel the tension, feel how tight it is. And a lot of us walk around kind of like this. Well, maybe not quite this bad, but let's drop them down again, okay? And you can feel the difference between that. And normally I said you can do this throughout your body, but for now we're gonna just do this on just for our shoulders and feel how that feels different than maybe when you started. And do that several times with these muscle groups. But I also want us to try a little stretching and yoga. So even if you have just a few moments, you want to do some stretches. If you've been Zooming all day, that's for the educators here. If you've been Zooming all day, you need to take yourself away from your screens because it's not really good for us to not look away every now and then. So what I want you to do is to put your hands in prayer position, okay? We probably do that for our spirit as well if you're a praying person. So we want to put our hands in praying position. And I want you to take a deep breath in. And as you breathe out, bring those arms out to the side and reach out to your side. And then bring them up above your head, kind of in that prayer position again, only straight up. And then breathing out, bring it back down to your chest in prayer position. One more time. Breathing out to the side. Breathe in to the ceiling and down to your chest. Now put your arms back behind your head and stretch those elbows back. And bring them in and curl up into a little fetal position. Take a deep breath in and stretch back out again. And one more time in. And stretch out. Now I want you to grab a hold of your chair, okay? And I want you to turn as far as you can, your neck and your head, and look as far as you can out to the direction. If you have a window, look out. And this is a good exercise to get away from your screen. So stretch out, turn into that position in the middle, and switch to the other side. Don't forget you're breathing in and out. One more time to each side. Stretch, looking out as far as you can across your room or outside. And one more time. And one more time with our hands in prayer position. Breathing out. Up to the ceiling. And down. Again, you can take as long as you want to do this yoga stretch, but it's good to do this about every 10 minutes or so when you're at your computer or even when you're working, okay? Take a few moments when you're taking a break or even in the hall when you're doing something and stop in a minute and don't forget to do your breathing and your stretching.
Wow, thank you, Karen, for helping us practice some body relaxation. That was really helpful. Another important aspect that we've mentioned is coming up is the idea of some spiritual care for ourselves. And one spiritual goal that we could work toward is something called finding meaning. What is the meaning of your life? What is your purpose and joy? And ask yourself, how can you get more of that thing that is so meaningful to you and brings you joy? What makes you feel energized? Another thing that's suggested for you to do after a shift at work is, what are those first that you look forward to when you get home? The first things that you want to do, and what makes your spirit feel whole again? So is it a walk? Is it playing with your dog? Is it running with your kids, reading a good book, getting lost in a hobby? Those could all be things that just are simple, but really help you find meaning and help you turn back to the things that are most important to you. Another question that you might ask yourself in terms of spiritual meaning is, what are your protective factors? Do you have some? And research reveals that the practice of gratitude actually protects us from stress and maintains our spiritual buoyancy. So when we are grateful, we feel better, we feel connected with others. And so it's really encouraged that you try to find gratitude in each day. Also, you can have a protective factor of seeking support from others. And again, this protects us from feeling alone, from feeling isolated, and maybe from feeling in a rut. And another aspect of this is that it does connect you with other people if you are seeking support. And spiritual healing can also extend from that power of positive thinking. I think reframing is an important tool that I have learned and that I encourage you to try to do. And that's just this idea of shifting the lens and reframing things that are going on around you. It will change your brain paths to thinking in a more positive context. Our brains are powerful, therefore our thoughts are powerful. So an example maybe of turning a negative into a positive would be, you know, we all get down on ourselves and maybe we say, well, I didn't get that work done today. I was disorganized, or I lost my focus, or it wasn't my best work. And a positive reframe of that is just, whatever you did today, it was enough. What you do now is what matters most. Be kind to yourself, be someone you want to be around. And with our thoughts, we create the world. So the more that you change your thoughts to be positive, you can create a better world. Thank you.
Okay, so a reminder as we close, the key takeaway from these skills, this toolkit of a few resources we provided: make a plan, focus that plan, try to look at this as more than just a resolution, as sometimes we do at New Year's, but something that you stick to, and reflect upon what coping is for you then too. The whole notion about adapting to adversity is something that's potent, but it's a thoughtful activity. It's a thoughtful pursuit. So in doing so, we foster resilience. We basically invest in ourselves to seek resilience, and we have the power to do so. Consider practical interventions because we are busy and there's a lot going on. So consider apps, a couple we just mentioned here, Insight Timer and Accountability Partner. They give you a platform, they give you ideas that you can operationalize quickly. So it's just a reminder, it's great to have a plan. Make one, try to adhere to it as best you can, and come back to it. It will serve you well.
So as we talked, just a few moments, give you just some quick examples of what to do for self-care. The important thing to remember, as Todd's mentioned, is to make a plan and to think about our mind and our body and our spirit in all aspects of caring for ourselves. And the main thing is to just do it. No matter how long it takes, a little bit here, a little bit there, just for a moment to take that time for yourself. I know that walking and looking at nature helped me survive during the COVID quarantines. I want you to just take a moment now as we close to take another deep breath in and take a quick scan of your body and see how you feel now compared to when we started. So breathe in, focus on your body, breathe out. Breathe in and breathe out. Thank you and be well.
Thank you to our wellness presenters. And so to close out the evening, I'd like to welcome Dawn Goodoff, the Chairperson of Nursing and Public Health at Moravian College. Dawn.
Hello, thank you. My name is Dawn Goodoff, as Charlene has mentioned, and I'm the chairperson of the Helen S. Breidigam School of Nursing and Public Health at Moravian College. As we've heard tonight, 2020 has marked a dramatically different educational and healthcare experience that will be remembered for the rest of our lives. Faculty have been forced to rapidly adapt and develop creative learning experiences that have engaged students while also maintaining the variety of roles within their home. As the number of students are forced to learn from home has increased during the COVID-19 pandemic, it has had major implications for the way in which students have lived, learned, and worked, which ultimately impacted the physical and mental well-being of individuals in profound ways. Despite the chaos that has been unfolding, the true heroes of the pandemic emerged, and my apologies, Sarah, but you have all been truly inspiring. Tonight we had the pleasure of hearing a few of the stories from our hometown heroes and frontline nurses, as well as our classroom heroes. I hope tonight's symposium was able to provide you with just a small reflection of the amazing work that has been done since the start of the pandemic. Despite the challenges that we've all experienced, please know that the collective programs of nursing have prepared you to meet the complex healthcare environment that you will be facing. We all stand ready to support you as you embark on your professional career. I want to personally thank all of our panelists this evening for sharing your very personal stories and words of advice. Thank you to Dr. Hastings, Ms. Peterson, and Dr. Adamczyk for reminding us of the importance of self-care, particularly during the times of crisis. I want to also thank the Nrclv Planning Committee for their time in preparing tonight's wonderful events, and in particular, Ms. Charlene Bergstresser for her hard work behind the scenes and keeping the committee on task. I want to thank Dr. Mayam Pasquale for planting the seed for tonight's event and bringing light back to the committee as we were forced to pause last year. I want to sincerely thank those who continue to fight this pandemic. Your hard work and your dedication is providing hope and light to all of those who truly need you. I want to thank our students and faculty who are joining us this evening, as we know how different this year has been, and for your patience and resilience as we've all faced this difficult battle together. And finally, I want to thank our clinical partners who are here tonight and joining us this evening as we have provided the guidance and leadership to all of our programs of nursing during this crisis. I hope you will all take time to complete our program evaluation, which you will receive within the next few days. And please feel free to share with the committee any of the reflections that you may have on the experiences during the pandemic. This concludes our program. We want to wish you all the best and urge you to continue to use evidence-based data as indicators in making informed decisions about your health and the health of our communities. Thank you for joining us. Stay safe and good night.